Hello, my name is Jessica Contreras. My project is on address nurse staffing and patient safety in an acute care setting. So the rationale or the purpose for this project is because inadequate staffing and high workload can lead to serious consequences. Things such as unfinished care, precarious safety factors, high risk for hospital-acquired conditions, and high rates of mortality, high turnover, nurse stress, burnout, and job dissatisfaction. So the significance of this proposal is because nurse staffing has continued to be an issue throughout the country, has exacerbated since the pandemic, and staff shortage and unsafe ratios have nurses leaving the profession altogether. Adequate staffing is related to patient safety. So my question is, in an acute care setting, does implementing methods to improve work environment to address staffing compared to those that may use travel nurses or new graduates improve patient safety and outcome during hospitalization? So in one of my literature reviews, an internal employee satisfaction survey in an acute care hemodialysis department recorded a significant dissatisfaction among registered nurses. Factors that are associated include number of on-call hours, overtime hours, lack of help, being unable to take breaks, etc. This article implements a Lean Six Sigma strategy originally created in Japan to identify and solve problems. In the end, they determined the number of hours of care for each patient based on acuity and special needs, and then using a staffing template to adjust nurse to patient ratio accordingly. And then by adjusting the ratio, rates of overtime decreased, available time for a break increased, and overall satisfaction increased. Another article reviews methods to improve work environments that is associated with better staffing outcomes. Recommendations for practice includes elements such as effective communication, improving teamwork, interprofessional collaboration, autonomous practice, evidence-based practice, patient-centered care culture focused on quality care, and meaningful recognition. These are factors that come from the Magnet Recognition Program that encourage a positive work culture. So to focus on improving patient safety, nurse staffing and work environment must be addressed. This primarily affects the patient's well-being to prevent hospital-acquired conditions, since inadequate staffing is associated with poor patient outcomes. Improving working conditions can increase staff retention and also improve the nurse's well-being by preventing burnout and fatigue. There's also been research showing when hospital administration focuses on staffing issues, they also invest in better patient outcomes. So staffing is a complex issue that cannot be addressed easily. This project can take up to 6 months on 2 different acute care floors. One floor would use methods such as assigning a nurse to patient ratio based on acuity, staffing the floor appropriately, and there will also be an effort to improve work environment, such as promoting a positive culture, appropriate compensation, interprofessional collaboration, and authentic leadership. There will also be methods to improve staff relationships in order to increase teamwork, such as meaningful employee recognition, staff outings, and etc. Other methods will include attenuating self-care by encouraging personal time off, the ability to decline overtime when stressed, and creating a break room for stress relief practices. Building a social support system can enhance the resilience factor in the work environment. The American Association of Critical Nurses implemented a framework that outlines an approach to improve work environment and is also an assessment tool. The assessment tool identifies problems and evaluates progress using an 18-question survey. The assessment evaluates communication skills, collaboration, effective decision-making, appropriate staffing, meaningful recognition, and authentic leadership. This tool could be used to determine a healthy work environment related to improve patient outcomes. So first, job satisfaction will be evaluated using the assessment tool I suggested earlier. And based on job satisfaction, we will then evaluate appropriate nurse-to-patient ratios based on acuity-based patients. Next, we must determine the outcome of the effective staffing based on prevention of mortality and hospital-acquired conditions or injuries. Evidence supports the assumption that an increase in nurse-to-patient ratio is associated to decrease in these events. We will also evaluate the number of readmissions, number of incidences of miscare, length of stay, and patient satisfaction. If successful, this implementation could be used in other units that intend on improving patient outcomes. If the intent is to improve patient outcomes, staffing and work environment must be addressed. In an interview with the nurse manager of the trauma unit, we discussed nurse staffing concerns and interventions that have been taken to address these issues. He emphasized methods such as taking bedside report inside the room to improve patient care. He also had employees send bios personally that are displayed in screens throughout the unit to straighten relationships and teamwork. He also encourages self-care and stress relief practices during work, such as utilizing the hospital's Oasis room that provides quiet time and snacks. He also aims to discourage gossiping, nurse bullying, and cliques that could be harmful in the work environment. And since nurse satisfaction has improved, turnover has decreased, and he quotes, "The past 6 months was the first time this unit has ever met its patients' experience goals around nurse communication, and that's a huge step in the right direction." So in summary, nursing is a dynamic field that requires continuous training and education. Staffing is the most important aspect of a healthcare facility. It is a major defining component of overall patient safety and care. It's a factor that must be addressed by facilities, especially during times of a pandemic when nurse staffing is exacerbated. Putting in effort to improve staffing situations can significantly improve patient outcomes, involving fewer medical errors and nurse burnout. And that is my presentation. Thank you very much for listening.